time now is 8:14. Children's Hospital, New Orleans, public schools, and the city of New Orleans team up to help combat the mental health crisis in our students. They've just announced a new $10 million partnership. It's part of the Thrive Kids Student Wellness Program. Very exciting stuff. We have Children's Hospital's Director of Community Benefits, Emily Wolff, to talk about how they intend to fight this issue. We were talking during the commercial break. It is tough to be a kid these days.
It is. I mean, our kids are really dealing with unprecedented times. We've known that, of course, with COVID-19 and all of the anxiety and depression that so many of our students have faced. But beyond that, in our city specifically, I think that the kids growing up here, we have some of the highest poverty rates in the country. There's just a lot of mental health challenges that our children face, and we're really excited to be able to help stand in that gap.
Yeah, so based on some of the things you mentioned, like COVID-19 and some of the other social economic issues that we face here in New Orleans, are we seeing mental health on the rise here in New Orleans?
Yeah, so I mean, nationally, we know that 1 in 5 kids will struggle with mental health between the ages of 13 and 18. But locally here, again, in New Orleans, about half of our kids in New Orleans public schools have suffered some kind of mental health struggle, from violence in our community. And so, we are really focused on being able to bring resources to where kids are to make sure that we can meet them where they are and support them.
Because especially if it didn't directly impact them, they're seeing the stories circulate on the news or on social media, or they hear about it in their classrooms, and it could just be as simple as, now I'm scared to even leave the house, that doctors can help work with them.
Yeah, absolutely. So, our team's going to bring in those medical and mental health providers to be able to meet students where they are. I think of a student who, on test day, was in the closet and just could not take a test. And our program that was rolling out, we were able to meet that student where they are and found out that student had witnessed, 3 homicides amongst his family and friend network just in the last year. And so, it's not just simple test anxiety, right? Like, this is deeper, and we want to be able to get to the root of the problem by meeting students and addressing those needs hands-on.
And that's what this program is all about. Let's talk about Thrive Kids program. How will this help students?
Yeah, so our program is a school wellness initiative that brings social workers and licensed professional counselors into schools to directly meet students with that support. But we also will, be providing more district-wide resources for students to be able to remove barriers in access to care, whether it's transportation or interpretation services, or maybe they don't have insurance.
Kind of just meeting them where they're at. Do you have to enroll, or is this just going to be at the schools?
Yeah, so we're really leaning on and excited about our partnership with NOLA Public Schools, who's helping us to message this all throughout the district to students. It's available to anyone, and we're going to be rolling out that information in the new school year. But in the meantime, if people are curious, of course, they can go and visit our website, chinola.org/thrivekids, to learn more about it. But it's really open to anyone to enroll and get connected to support.
Really a great resource to have for our kids. Like you said, kids are dealing with a lot these days, and so meeting them at their level, where they're at, I think it's going to be nothing but a positive experience.
Yes, thank you so much.
All right, Emily Wolff, thanks for being here. We appreciate it.
Appreciate it.